Today we're going to talk about Chapter 2, which is Medical Practice Management. There's a quote by Katherine Whitehorn that I had actually never heard before. I love it. It says, "The best career advice to give the young is," quote, "find out what you like doing best and get someone to pay you for doing it." That's exactly what I've done. I absolutely love taking care of people. And I also love educating and inspiring others to do what they want to do, to follow their dreams. So that's why I'm here today. I figured out what I like doing, and I found somebody to pay me to do it. When we're looking at medical practice organizations, there are several different types of organizations. And with these different types of organization, you're going to have varying compensation, responsibilities, and liabilities. You've got sole or single proprietorships, partnerships, professional service corporations, group practice, and then health maintenance organizations. Now let's explore these in further detail. With sole or single proprietorship, the business is owned by one person, one single individual. And this one single person is going to receive all the profit. But this person is also going to take all the risks. This is actually the oldest form of management. In a partnership, you have an association of two or more persons who are co-owners of their business. This type of practice definitely needs defined partnership agreements because these people are going to share in their responsibility. They're also going to share resources, and they are going to share in the liability. So you can imagine how if someone is incompatible with their partner, if they decide they don't get along, that it's really going to cause problems within the practice itself. Then you've got your Professional Service Corporation, or your PSC. This is a legal entity with one person or a large group of individuals. The organization where licensed individuals render a professional service. This is very costly to establish, but it is financially advantageous. In group practice, you've got three or more providers formally organized to provide medical care through the joint use of equipment and personnel. Three different types of group practice are going to be your single specialty, your multi-specialty, or your primary care groups. Then you've got health maintenance organizations, or HMOs. Here, a group contracts with clients to provide comprehensive health care and preventative medicine for prepaid fees. This is a staff model HMO, and your private care provider, your PCP, works as your gatekeeper. Managed care, that's where you have contractual agreements between groups, organizations, providers, and clients to provide medical care to an established number of clients. This is not a form of business management, but it affects all aspects of medical practice, especially benefits and reimbursements. You've got different payment methods. You've got fee for service. You've got co-payments, deductible, capitation, pay for performance, opt-out option, and then just straight cash. You've got other types of business arrangements, joint ventures. That is between a hospital and providers, a provider-hospital organization, or a multiple service organization. And then you've got your preferred provider organization, or your PPOs. Some examples of joint ventures are going to be if your hospital builds a clinic, or you have in-store medical clinics, or then when hospitals and providers go in together. Provider hospital organizations are really neat because it's a one-stop shopping approach to healthcare, and it combines services. Makes it really easy for patients to get everything that they need in one place and not have to go to different areas. MSOs, or multiple service organizations, those are owned by doctors, hospitals, totally separate party, or combinations. They're formed to manage provider office management services. They often handle secretarial office stuff, your transcription, billing, collection, and then they do group purchasing. To explore management organizational models, toolkits, and suggestions, go to the website that you see. You may not see it. It's www.himss.org/ASP/topics_management process.asp. Here you're going to be able to compare and contrast different types of medical practice management. You've got different types of general liability. You've got business license, you've got building liability, automobile, theft, fire, burglary, employee safety, and bonding. In summary, physicians and providers can open new practices, function as sole proprietors, be employed by others on a straight salary basis, establish partnerships, become part of PSCs, and practice alone or in groups. Most also will be related to some form of managed care and may participate in at least one HMO. All forms of medical practice have advantages and disadvantages. The choice depends on the individual personality and preference of the provider. None should be entered into without advice and consideration from people knowledgeable in the field. The overriding factor for providers to consider is what type of business organization will best permit them to serve their clients. Providers must remember that the type of practice chosen will dictate their responsibilities in all areas of general liability. To be less than meticulous in this area of business can potentially mar a provider's professional reputation.